I'm Doug Edwards, Director of the Psychiatry and Behavioral Health Learning Network. And today I'm joined by Dr. Saundra Jain, an adjunct clinical affiliate at the University of Texas at Austin School of Nursing. Today we will be discussing key research findings around psychedelic-assisted psychotherapy and what you, as a practicing clinician, should know about this emerging treatment option. Dr. Jain is a globally renowned educator and co-investigator of the Psychedelics and Wellness Study, also known as PAUSE, and is on the steering committee of the SANA Symposium. Welcome, Dr. Jain. I'm delighted you could join us.
Thank you so much, Doug. I can't think of a more enjoyable way to spend part of my day today than meeting with you and talking about this super exciting area of research and practice.
Well, let's dive right into it. What should your fellow clinical professionals know about this emerging area of psychedelic-assisted psychotherapy?
It's such a great question, Doug, and one that I actually spend a lot of time thinking about. Let me see if I can answer it this way. One of the most common questions that I've received over the last 3+ years since we've been doing the PAUSE study is this: should I get training? And where do I start? And that is not an exaggeration. The interest in this work is absolutely profound. And I think many of us, like I was at one time, are new to this space. And I would say this, that no matter in the world of psychedelic-assisted psychotherapy, no matter what model of or training a clinician decides to pursue, I think it's really important to just be aware that there are 3 stages to psychedelic-assisted psychotherapy: preparation, the psychedelic session, and integration. And if I may, Doug, just comment on 2 of those because I think it's so important. And those are, first, preparation, because that increases the potential for a participant to really have a beneficial psychedelic experience. I mean, we all know from what we've been reading and what we're learning from the research is that set and setting is crucial. And then integration, and seeing that as the key to really prolonged, and this is important, sustained improvements.
And let's dive a little deeper. Let's talk a little bit more about the training aspect. So there are a lot of programs that are emerging in this area. What do you suggest that providers look for when selecting one?
There's that question, Doug. That's the important question, the one that's top on everyone's mind. I'm so glad you asked it. So again, tons of psychedelic-assisted psychotherapy training programs, and they are popping up at a rate that's really almost faster than we can keep up with. But before we dig into it, I'll mention a couple. I think it's important that we consider that there are 4 central principles that recur, or they're a common theme, if you will, across the various models. And those are mindful awareness, certainly, acceptance, commitment, and then 4th, psychological flexibility. And so just keeping in mind as I kind of walk through just a couple of these different models of psychedelic-assisted psychotherapy and their associated training programs, that those are the central themes that, again, it's that common thread that I believe ties them together. And so some of the programs that I know many of our viewers today are going to be familiar with: MDMA-assisted psychotherapy, psychedelic psychotherapy from MAPS, the ACE model from Dr. Rosalind Watts. And so ACE stands for acceptance, connection, and embodiment. So one program, one approach to psychedelic-assisted psychotherapy that many are not aware of that I want to make sure that we just toss out there: cannabis-assisted psychedelic psychotherapy. Of course, ketamine-assisted psychotherapy is an FDA-approved, some refer to that as our only legal psychedelic for treatment at this point. And then there are other psychedelic-assisted psychotherapy models currently in phase 2, phase 3 for studies for treatment-resistant depression, major depression, and also PTSD. But again, Doug, I'll say this. The most important thing in my mind is just that understanding and realizing that there are those 4 elements that I just mentioned a moment ago that really are integrated across all of the models. Because I think it adds to and enriches this conversation about training programs, because there are a lot. And I know there is a sense of overwhelm with my colleagues and people reaching out to me really from across the country. Which one's best? What do I do? Do I do it now? Do I wait for FDA approval? All great questions. And I think the central point is this. These treatments aren't yet FDA approved other than ketamine, and right, that's the only one that is approved at this point. So it makes it difficult to decide, because what's unique about this, Doug, is I believe this is the first time ever that the FDA is going to absolutely require psychedelic-assisted psychotherapy to be part of the intervention. So historically, rather than it being FDA recommends CBT with a particular medication or a particular intervention, we really believe, many in this space believe, that FDA is going to require it. Now, at this point, that's just my opinion, not fact, but it seems to be leaning in that direction. So I would say this, as you begin to research the different programs, just keep in mind that common theme, that common element that ties them together. Do your due diligence. Nothing prevents us from calling those programs and having a phone call to talk about what will I be doing over the next 9 months, over the next year. We have to keep in mind things like COVID, the pandemic, still restricting that face-to-face long weekend trainings that are part of the didactic sort of Zoom-based training program. So lots to consider, but what I love about it, even though there's lots to consider, the opportunities and the options to find what is exactly perfect for you is quite vast.
Yes, there's certainly going to be a lot of opportunities for professionals of all different clinical backgrounds to really make a difference in this emerging area. And I'd like to thank you, Dr. Jain, for joining us today. And speaking of education, ladies and gentlemen, I hope you can join Dr. Jain and myself to learn more about the latest in psychedelic research and treatment strategies for mental health and addiction professionals at the inaugural Sana Symposium. It's a virtual event taking place this September from the same team that brings you Psych Congress, the evolution of psychotherapy, and the national conferences on addiction disorders. Be sure to visit sanasymposium.com to learn more and to register.